Today we are joined by the brilliant John Goodwin and Karen Pavey. John will be presenting on CQC from the perspective of an LGA peer reviewer, having amassed 40 years of experience in adult social care. John is currently working as Assistant Director at Kent County Council and also as a peer reviewer with the LGA. Karen will then present on preparation and outcomes following the inspection they underwent as part of the pilot scheme. Karen was the DAS at the time and now sits as the Exec Director for the Council. Following on from their presentations, there will be a Q&A session. This will give you the opportunity to ask both John and Karen any questions you may have about their presentations and CQC. Please put your questions in the Q&A tab and we will come to you if your question is asked. We can take away questions for John and Karen as a follow-up should we not get through them all. If you are unable to attend the full event, the recording will be sent out in the coming weeks, so you can keep an eye out for that one. We know you've all got busy days. Now I'll hand over to John, who will begin our presentation. Thanks, John.
Thanks very much, River. Good morning, everybody. Breakfast briefing. It would be great, wouldn't it, to have had some croissants and coffee delivered at your door behind you as this happens, but sadly we're not able to provide that technical support with that. So I'm John Goodwin, as River has said. I'm going to walk us through some of the process, and Karen will then talk about the actual experience of CQC coming in. But I'm going to give a bit of a nod to the LGA, so that's why you'll see some of my slides focused on from an LGA perspective as a peer challenge manager. But I'll talk that through. So next slide, thank you. So just a little bit about me, 43 years in adult social care, starting with Leonard Cheshire. Way back 1981, it's another century, another time, but actually just kind of setting the scene for my career in adult social care, predominantly in the southwest, actually, working in Somerset for Somerset Council and NHS Somerset, and working as a social worker, team manager, practice educator, service manager, and then I left Somerset. And since then, in 2017, I've been working as an interim leader, working across with a number of authorities, as you can see there. And what that's done over the last 2 or 3 years, really, I've been in roles where I have been leading on assurance and focusing on that, both from a principal social worker perspective, as well as an assistant director. So that's been really, really good in getting me driven around the whole subject area of assurance. And certainly, as River says, over the last few months, I've been working as a peer challenge manager for the local government association, which has brought about an additional lens focusing on assurance. Thank you, River. So let's just go back to some basics, really. So most of you will all know this in terms of, so I'm not going to focus on talking through the slides in detail here, but people at the heart of care, December 21, that real strong focus. And I think, Helen Whately talked there very, very clearly, as you can see, clear things that she is expecting in the market of adult social care and the business of adult social care. And these are really, really strong sentiments that are well intended. Obviously, I think I would say, and Karen would say, that these are things that we would want to have, all of us would want to have on a day-to-day basis within adult social care. But predominantly that paper talks about choice, control and support to leading independent lives. And that concept of a gloriously ordinary life, and people can access outstanding quality and tailored. That's the important thing about the Care Act, isn't it? It's very, very clear in terms of good outcomes for people that strongly focus on well-being, and people have access to that they have their care and support offered in a fair and accessible way. And we all know at the moment the whole cap on care has been pushed down the road yet again, and I suspect because it's a very tricky and wicked issue, that one will continue to push over the next few years, and it will be a brave new government, if that's what we have, in order to take that on. Next slide. So moving on from that paper, key piece of legislation really in terms of the Health and Care Act, And that really does put the framing for CQC to come in on a very clear statutory legal level, the duty for CQC to assess local authorities, not just providers, but local authority commissioning and local authority operational adult social care under Part 1 of the Care Act. And really, really clear. So if you just click there, River. So good quality care and support, enabling people to live fulfilling lives. You know, that whole subject of increasing transparency and local accountability for the local population in that local authority area, and holding the local authority to account. And as I've said there, these are again repeating words, but very much seated in that piece of legislation. Enable access to consistent high quality care and support, irrespective of where people live, and very much focused on avoiding postcode lottery. Next slide, thank you. So CQC focus on the 4 themes, and I recognise that amongst you all, you know, you'll have covered all of these areas and be very familiar. So I'm going to just give a bit of a very quick push through all of these. So 4 themes: working with people, providing support, safety, that whole area of safe, and the leadership of the organisation, and focus specifically on some quality statements. So thanks, River, if you just want to go through these. So quality statement 1 under that first theme, you know, this is very much around the assessing bit, that whole focus around making sure that people have, you know, a proportionate, and this is the key thing, a proportionate assessment. And again, you see the well-being word there, and co-produced, that whole concept of an assessment that is co-produced, a support plan that is co-produced with the individual and their carer, and making sure that that whole access to that assessment, that access to that, is done in a really, really timely way. So coordinated, everyone works together to pull that, and absolutely seeing the individual as unique. Thanks, River. So again, quality statement 2, this whole promotion of supporting people to lead healthier lives, maximising independence, choice and control. So very much information, advice, guidance, front door services, really, really important. As we know, the front door has a massively important role in terms of making sure people have access to the right information so they can make the choices about their life, and they can, you know, ultimately lead independent lives without having to come to adult social care in the first place. So often adult social care has systems where people land in the service and we instantly assess them, and then we transfer them on and we assess them again, and then they're assessed again. People lose track of their story, they repeat their story several times. So all of these quality statements, you know, around assessment is around the way in which that is done, proportionality, enabling people to have great conversations without necessarily having an assessment, you know, actually really focusing on good quality information and advice, and helping people and just supporting people in the right proportionate way. And then, as it says there, you know, very much around equity and experience, and actually ensuring that equity brings up a level playing field in terms of the support for that person. So seeing that individual very much as a unique person, as it says there, with the skills, strengths and goals and their individual talents. That's what Good Care Act assessment is all about, isn't it? So the second theme, and again, you know, working through the quality statements, care provision, this bit really is about the actual support. When people do need support, is that they've got access to it, and actually it's joined up and coordinated. It sounds simple, doesn't it? But actually it's really joined up, it's coordinated, it's flexible around the individual. Everyone works together around that co-produced support plan. There's good contingency in place. It's an excellent support arrangement for people to have. And ultimately, people have the greatest choice and the greatest control over that support, ideally with a direct payment, with support services in place if that's what they need. So that self-directed support is very much there. And that partnership and community approach is about the collaboration of services working together. So that's very much around, it might be, registered providers, but it might be a range of voluntary agencies as well, and actually working together again for the great outcomes of the person. The third theme, as you'll know, is very much about safe. So that's about safe in the system and that whole that pushing of safeguarding, and really again working in terms of safeguarding partnership boards, everybody working together to have good, strong systems to ensure that our public are safe, that we're safe from harm or abuse, and that actually there's good structures in place there to make sure that support is monitored, and actually we have an arrangement in place to make sure people are supported at the right time in a very, very proportionate way. And ultimately, if people do move between support settings and arrangements of care and support, that again, that's very coordinated. There's a clear plan in place. It sounds easy, doesn't it, to say these words, but we all know, and there'll be many practitioners and managers and leaders on this call today, often these are the things that go wrong, and these are the things that end up for us being really tricky and difficult in terms of having to put in arrangements to support people, particularly where people might be resistant to care and support, and may have a range of issues or a range of difficulties in terms of enabling a good life. Seventh one really is about how partners work together and there's good safety in the system, and ultimately, we are focusing on improving people's lives whilst protecting their right to live in safety. So it's all of that kind of approach of having a partnership approach to safe within the system. I was just going to say, actually, on that final one, that's very much picking up the essence of making safeguarding personal. So, all of that essence of the person is in the centre of all of that system, and the support arrangements are all coordinated together. So the fourth one then is about leadership and the governance arrangements and the sustainability of the service. So clear roles, responsibilities, good governance, good assurance. Those questions around assurance, how do we know? Have we got good systems in place in terms of our leadership of that organisation? And, we're very clear about the information that we have within the system. We've got good data. We have good data-driven decision-making within the organisation. And we manage risk in a proportionate way. So all of those structures in place for leadership is very, very important. So the final quality statement under leadership really is about the learning, the innovation, that whole approach to how the system works together, and that might be within the ICB, it might be with a range of voluntary partners, the VCSO in the area, and making sure that again, there is really good approach of services working together in their system, and there is a very, very strong leadership of that within the system. So I'm going to just move away from those quality statements and talk now. You go on to the next slide with it. So all of those are great, aren't they? They sound fine, they sound great in practice, but actually on a day-to-day basis, we'll have today a lot of people on this call are really thinking about, so what are the practical things that are going to be really important for me and my organisation? What are the things that I need in the mixing bowl in order to achieve a really safe, legal and effective, and ultimately, work to a journey of outstanding in terms of our adult social care service. And from the experience I have within the LGA and the experience I've worked with lots of other organisations as an assurance lead and a principal social worker and AD, these are the things I would say are really important things to put into the mixing bowl. Have a plan. Have a really, really good plan that's built on evidence. This is about a great self-assessment that really shows the work that an organisation does, that you do as an organisation, It's co-produced, that plan. It's co-produced with people with lived experience, with carers, with voluntary sector, with the ICB. Really make sure that plan is there. Importantly, that plan has to cover a range of things. So, get the basics right in your service. Make sure the things that are there about having an understanding of why we do what we do. What is the vision of the organisation? How does that set out its vision for great support for the public in the area? And be able to articulate the carers offer. And that's again, important words, but so important in terms of co-produced carers offer, co-produced, these visions and statements are really important because it sets the standard for your area. Mentioned about the front door in terms of prevent, reduce, delay. Very important to have and understand what is the role of the front door in your service, making sure that that front door really doesn't vacuum up people into traditional care and support, but actually what it does is enables, with the right level of conversation through skilled OTs, skilled social workers, skilled people that can enable people to ultimately find alternatives that are much more appropriate and proportionate to their particular situation at the time. And build your evidence. So CQC and the LGA, if we come in as a peer reviewer, CQC will look at three things. They'll look at areas of what they read, what they hear, and what they see. And they will connect them together. They will triangulate those areas. Really important that, actually those three areas should triangulate together. They should all connect in terms of making sure that you have a story, you're cognizant of the story. It's okay to say these are the areas we're developing. We're not so good at this, or we're on a journey with this area. That's really important to say that. Really important. Not just that this is a big glossy self-assessment, and actually when we dig down into it, we're finding areas that we're struggling with. So as it says there, be cognizant of your own strengths, but also your areas of consideration, and be very open about them. Relationship building is really important in the system. So making sure that, your system shows a system as a whole, that you're not just one adult social care service working in isolation, for example, to the voluntary sector, health colleagues with the ICB. Making sure that it's a shared story is really important. And partners agree on the position of where we're at the moment. So often I see, when I go in working with local authorities, different partners have different perspectives on, actually, no, it's not like that at all. And CQC will look at that in exactly the same way. It's really important that you share that story, you're able to articulate where you're at. I've mentioned already about governance and accountability, but having good assurance structures, having perhaps an assurance board, or having a clear structure in there that sets out the ways in which you look at your organisation and check its quality is crucial to a well-functioning organisation that has great quality checks. And within those quality checks, you can evidence why you believe that service really promotes great well-being outcomes for the residents in your population. I've said there, know your numbers. So counting the widgets is something we do an awful lot of these days, isn't it? But it's actually making sure that, the question there I've said is, are you intelligence rich rather than just data rich? So many organisations I work with have a huge amount of data. Arguably, they've got too much data, but they're not doing the right thing with it. So intelligence rich is really important. You're using that data to make sure that actually that is the key to helping you drive forward your decision making within your organisation. And it's really relevant, and that staff on the ground understand how, if there's delays in the system, that actually they understand the safety and the mitigation they've got within that, and that there's a strong narrative that sits behind all of that. Common one is often about strategies that aren't updated, and they're often old. So CQC will come along, the LGA will come along and look at strategy and will say, well, this is 5 years old, 6 years old. Yeah, no, we haven't got round to that yet. It's important to say, even if you haven't got round to that yet, that you're on a journey and actually put plans in place to have those strategies refreshed and updated and really ensure they are co-produced. So as it says there, evidence of true co-production. It's a very easy word, co-production, isn't it? It's a word that we would say, oh, everything is co-produced, but evidence of what that really means, not just engagement, it's true co-production, co-designed with members of the public, with people with lived experience, with carers. This stuff takes time, but it's so important to get it right and do that. And yeah, as I've said, working across the ICB and making sure your plans are really well socialised. The self-assessment that we all have in organisations should be well socialised. People should understand it and have systems in place to refresh that self-assessment every 3 months, so that actually it remains a live document. It just doesn't sit on the shelf and gathers dust. And yeah, learn, act, and share of any peer challenge review you've done recently. So I think it's the final slide from me, and I'm going to pass over. So I'm just going to give a quick promote, really, and that is about the role of the LGA. The LGA is a really important partner and support of your organisation. It's a really excellent way of having a really great opportunity for a group of peers, a group of people like Karen and myself and yourselves, coming into an organisation, 6 or 7 people with great experience of adult social care and working with you and your organisation for an intensive week and actually providing the exact same approach that CQC take in their inspection. So it's a mini assurance, a mini inspection, and what that will do is it will really help you to understand your current position. And yeah, I've got to put a plug in there on that one, because why wouldn't I? Okay, so that's it from now. Those are my contact details, and obviously I'll pass over to Karen.
Good morning. Good morning, everyone. Thanks, John. That was really good. And obviously gave the context and all the policy that sits behind this inspection regime. And just on the word inspection, I think what I'm going to talk to you about is how North Lincolnshire approached the pilot assurance. And I have to now use the word assurance, but I will be totally honest with you and tell you that we use the word inspection all the way through and continue to use it, and I'll explain why in a few minutes. So yes, I'm Karen Pavey. I'm Executive Director for People at North Lincolnshire Council. At the time of doing this, next slide, please. I was the Director of Adult Services, Adults and Health was my title. In an attempt to retire, I got promoted, but we could talk about that another time. Just in terms of time, I thought I'd crack on. So North Lincolnshire Council took part in as one of the 5 local authority pilots between June and August last year, and it was quite incredible writing this, that I thought, oh, it was a year ago now that we were in this very weird world. I will explain. But I wanted to start with the end in mind, which is always a good way to write your strategies, by the way, in an outcome way. We did get a good, and you will see right at the end of my presentation, or I will mention again, we call it a good. So anyway, more of that later. Yes, it was a positive experience overall, and we were very keen to use this opportunity to build confidence in our workforce, people with lived experience that we're working with on a daily basis, obviously our partners, providers, and actually most of them in hindsight said it was a very rewarding experience. I will tell you a little bit about how we felt about the process, if you like. So this is much more the experiential presentation to support John's earlier comments. So next slide. So why did we do it? I'm sure you must be sitting there. Lots of people said to me, why did you do that? Although a lot of people said I knew you would. So obviously, if you know me, then there might be some other reason behind this. But I think where I was coming from, I was working with the government and James on the ADAS preparation group and working with CQC in terms of negotiating our path to a process way back. And also I belong in North Lincolnshire as part of the Humber region, and the four of us, so that's myself, Hull, North East Lincolnshire and East Riding, had started some work together at what we were calling our preparation. And that co-production and work with colleagues was invaluable, and that the support network was invaluable through this process as well. But what I wanted to do, I think, is I wanted to explain. I think this CQC assurance system is an opportunity for us to show the complexity and some of the fantastic work that social care does. And I wanted to get to a position where we could explain we're much more than the discharge arm of the NHS. We have a whole massive offer in terms of human rights, in terms of supporting people's entitlement, and supporting prevention, enabling people to live in their own homes, families, jobs, communities. And that is what we stand for. We are not just a bolt-on. So I was really passionate about that, and I remain in that position, having my part of my job now is to work on the integration agenda. And how frustrating is that? This was more fun, actually, believe it or not. So, and I think we owe it to people, we owe it to the public, we owe it to the taxpayer, we owe a degree of transparency in what we do and how we do it. And I think it can only improve services. However, I now oversee children's services, and the Ofsted approach, I think, has gone too far. So I would hope eventually we're in a position to influence how we do a transparent process, but have balance. So more of that another time. So calling it inspection, we did call it inspection, and I noticed you did as well, John, and that's because it's a language we all understand. You know, and even CQC, when they arrived or during the process they were on site, they were using assurance, they were using assessment, and not inspection, but and we had signs on the doors saying this room is reserved for CQC inspection team. So I had to explain why we use the word inspection, but it actually built support for us, because if you go around to your council and ask for help with doing an assurance assessment, people go, yeah, whatever. But if you go around and say, right, we need some help, we're getting inspected next week, they go, okay. So it was an important part of our communication, and our communication to partners also who wouldn't have understood that language. And you know, don't know if you noticed, but I called my presentation Building the Airplane Mid-Flight. And that's what we called it straight away afterwards. We were very popular with people going out and doing these presentations. And what I was saying was, what you've got to understand in your workforce is that you will have very few people, apart from the aged ones like me, who have ever been through any assurance process or inspection process. We have a strong history in North Lincolnshire of engaging with peer review processes. Most of my staff are peer reviewers, as well as we have a regular peer review approach. In fact, I'm currently leading our corporate peer review, which is going to happen in November. So we do have eyes outside of our authority, but the actual process itself brings a different level of stress. So it was important that we use that. We wanted to tell our story, and we wanted to make sure that people understood our real focus on outcomes and partnerships and people, because it was it is what we do, and we do it across. We have outstanding children's services for more than once, and you know, that's how we work. So it was really important for us to have that opportunity. But most importantly, I thought it was a great opportunity to create a safe experience for everybody, and you'll see I'm going to talk quite a bit about the workforce. So it was also a chance to maximise our learning, and we're always up for that, but also for CQC. So CQC did take a lot away from the experience, which was really helpful. So next slide, then we're going full hell into process, really. This is just to say that this is the process we went through is still the process that people are going to experience. You're going to get 3 weeks to return your information return. The self-assessment, when we did it, was optional. We took the opportunity. They did say you could choose to do a self-assessment. If you don't, we may need to spend a bit more time with you on our field work. So of course we did a self-assessment, but now it's mandatory. You are asked to provide, as John said, your self-assessment against those themes and quality statements. So we actually threw our hat in the ring the day before we were told that we were accepted, and now we had 3 weeks to do the work. So it was interesting. They also will start doing your assessment way before they arrive. As John said, they read, they look at the website, they start to talk to voluntary groups and stakeholders before they arrive, and then they triangulate, as he said, what you see, what they've seen and what they've heard with what you've told them. They also are continuing to do case tracking, and in a small authority like ours, doing 50 providing 50 individuals, case horrible, isn't it? Names of people that also were willing to speak to CQC, because CQC then want to talk to those people. So you have to make sure you've got their consent, and you have to make sure that they are prepared. And that's 50 people, but they will pick 6 by the time they get here. Maybe a couple more. They did for ours, but that's their a minimum. So and those are submitted. You then have 2 weeks after that period to provide some more detail on and a history of 10, of which they pick 6. So now I understand this timeline is still in place. However, there is a lag now because of them catching up, between them having the data before they start the work. For us, it was a 12-week process, and from start to field work. So it was a long 12 weeks. I've still got PTSD from it. Sorry, I shouldn't say that. Right, next slide, please. So in terms of process, yes, end of May, we said, yes, all right, we'll participate. June was then swamped with meeting their requirements. We had done some preparation work. We did have a sort of self-assessment, but when it comes to actually submitting what you've done to the outside world, you look at it very differently. And also we had to provide the data, obviously, to support our self-assessment. And again, one of the things we noticed was that our data, our policies, our procedures, our practice guidance all had different job titles on, rather than the name of the service, because they were called after my job title. And I have been in North Lincolnshire for 20 years. So you can imagine, can't you? So we also noticed that whilst we had a policy tracker, we had a system of updating all of our practice guidance and policies, we didn't ever really look at the front cover. So we did a lot of housekeeping at that point. So next slide, please. So now I turn to staff confidence. Like I said, nobody in my service except one of my assistant directors, who had been involved in the SEND inspection, had any experience of actual inspection processes. So it was very important for us to help our workforce engage in this process. And of course, at that time of the year, when we went out, and we went out very quickly and told them what we were doing, they said, oh, that's good, August, I'll take holiday. That was their immediate reaction across the whole structure, you know, from at every point. And I can tell you, a bit of a spoiler alert, actually, they really did enjoy the process once we got there. We did lean on children's services quite a bit. As I said earlier, they are outstanding, and they do know how to manage these processes. So we did talk to them, and they were very generous in supporting our journey, we did some focus groups, and they sat in and became the sort of external person, because our workforce aren't used to talking to people. So we use storyboards a lot. We took from them the storyboard process, and we're now going to be using it in our corporate peer review. But we use that sort of, so what are you doing? Why are you doing it? How are you doing it? What difference are you making? Right down to an individual team level, which we found really invaluable and is now in part of our whole performance and learning framework. So a really useful tool to get people to sit down together without any outside influence, just talk about what they do. They don't do it very often. So that was really helpful, and it brought their confidence up bit by bit. We also had some workshops facilitated by the partners in care. So the Local Government Association and others are really helpful partners, and I would definitely advocate that we all engage together in this approach, because we are better together, aren't we? I think someone's already said that. So next slide, please. We did lots of webinars. We did it weekly. We engaged our workforce across the board. It was easy to do it on webinar. People were very easy to be able to pop in. Most of them, they were set for an hour. They were probably 50 minutes. It gave everybody an opportunity to ask questions as we went. We could tell them where we were in the process, how we'd met the deadlines, and we did, which we were very pleased about. But also it kept us all going. It made us think about what we were doing. And basically what we were doing was telling them what we were telling people. So, and we did the same with partners and encouraged them to understand our self-assessment. As John said, you need to socialise what you've said. Now, we have a habit of doing that annual TLAP local account. And apart from COVID, we kept that going. So it was quite natural for us to drop in to our partners and scrutiny and our elected members the annual review of our services with the lived experience of people co-producing this annual report. So it was really building on that. But the technicality of your self-assessment, which is where, as John said, you have to put your data and your intelligence into what you're saying, is too dense and difficult for people. So I think we are saying we have always done that, because we've used in the Yorkshire and Humber region that opportunity to have a sort of peer challenge, DAS to DAS of our technical self-assessment, and then our public self-assessment was our local account. I don't think there's anything wrong with that. I think most organisations will have a technical document that really looks at the nuts and bolts of what they do and gives that triangulation, but also then present, this is what we've done last year and this is what we're going to do next year. And it's not difficult to understand what they're going to do next year is fed from knowing that they didn't quite hit the mark last year, or they want to do some new stuff the following year. And that's normal, isn't it? Let's normalize some of this. It's not, it doesn't have to be too complicated. What I want to say as well is that when you do this process, you've got to think about well-being of the people involved, because we lost ourselves, I have to say. Resilience, it was a word on an earlier slide that I missed. We very quickly realised that we really have to, you get all immersed, all weekends go, evenings go, because you want it right. You have to then remember to give people time out. So, tempers get a bit frayed, but, well, not tempers, that's wrong. Actually, just people got a little bit stressed at times, but also life goes on. So during this process of now, June to August, which was when we did it, you've got people celebrating degrees, you've got children leaving university and moving into life, you get your A-level results, your GCSE results, tragedies happen. We had all of that going on in your workforce who are approaching this process. Life is still going on for them. So they try, and most of us turn up with our working day head on, but when the working day gets blurred, so does some of that. So it's just being mindful that to take care of everybody. Next slide, please. So as I said, our workforce did go right through the spectrum of, August, that's good, I'll be on holiday, to actually, I really quite enjoyed that. I'd like to do it again. And this is a direct quote from the assistant director for CQC. Your staff have been very open and very generous, and please don't take this the wrong way, but their enthusiasm was sometimes a bit exhausting. So it's Amanda Strider, actually. I have told her I'm using her quote. Yeah, it was great. So we took that. Thanks very much. I'll take that. It goes on after the fieldwork time. So after our fieldwork, they were finishing off it was August, you're not going to get everybody around. We knew that, they knew that. We co-produced, co-agreed that, if you can't get everybody straight away, it will go on a little bit longer. They also then met our faith leaders after the inspection, which gave us a bit of what's the word, curveball, I suppose, because they were people that we didn't actually engage with on a regular basis. The council did, but not adult services. So that's a learning. And they also they wanted to ask for waiting list detail and so on, which we didn't have. So we had the detail, but we didn't have any waiting lists, if you know what I mean. So we were pleased with them asking about that. And they now make that quite a big part of what they do. We chose to send a feedback survey out to people to say, how was it for you? How did you experience the inspection staff, the workforce, the CQC themselves? And we were pleased to say that actually, and we fed that back to CQC, that actually people found that it was open, it was friendly, it was an attempt to get the best out of people. A bit like interviews, isn't it? If you interview in the old way, you don't really get the real person. If you're a little bit more flexible, you do get people talking. So next slide, please. Where are we in the process? We're at I've got 3 slides on it on overall reflections. I think I've covered most of those, so I'm going to skip those, I think, and do an overall good. Yeah, that was the slide that we put up when we shared our report. We had a long lag between our getting the fieldwork finished and CQC publishing. It was right from sort of late August, right through to November before the report was published. So we did do a webinar straight after the inspection and thanked everybody. And I'm really pleased we did, because we could then only keep people up to date with, we don't know yet, we've got a draft, we're doing that negotiation. There was some factual accuracies to sort out, but we wanted to celebrate. It's really good. And if you do get the opportunity to go read it, please do. And I'll just show you very quickly now a slide with 3 big quotes on it. Next slide then, please, River, thanks. So what they said, and this actually backs up what John said in terms of what you need to know and what you need to have in place. They did say that people's needs were assessed in a timely way. There was a strength-based approach. We were focusing on ability and wishes, and we had waiting lists were well managed, as in there weren't very many, and we had a trusted reviewer pilot. It's now part of our day-to-day business. Our partnerships worked very well, strong relationships at all levels. Just what John was saying earlier. We also had some good work with integration with health services, which I've been working on a long time, and our relationship with voluntary sector and our safeguarding was very strong. So overall, an open culture with some really nice feedback about our leadership and governance arrangements, all of which were, as John said, really integral. This is CQC is not it's for life, not just for Christmas, is the phrase, isn't it? And that doesn't mean CQC. It means your approach to your self-learning, your performance management, your check-in, your assurance, you're finding out what the lived experiences of people in your services, and you're matching it up with the data, and you're having conversations about what you could always do better, because we can always do better. So lastly, I think very nearly, I think yes, it was some funny moments. We went a bit mad at times. We did a Wordle of all the funny things that went on during our time. They mean absolutely nothing to you. Pigeon poo was an interesting one, if you want to ask me about it. But yes, we had some funny moments, and it was important to capture those, important to feed it back, keeping people motivated. And there was people saying, well, thank you for making us do it, because, you know, the reality was it was my decision. And with my lead member, obviously, he was involved in us deciding we were going to do it, because you never know what the outcome is going to be. Well, had an inkling, obviously. Yeah, so very lastly, I think just to say the whole thing was a big roller coaster ride, really. It was very emotional. It is inspection, but it's not Ofsted, and it's okay. And I think that's what I'd like to leave you with, that it really is an all right process. CQC really are trying to get the best out of local authorities. They are not keen on meeting middle managers. We were keen that they did, and they understood their role in the leadership structure and their role in informing the assurance system, but also best practice and assuring outcome-based practice. But they're still not keen. They are missing out a tier. So they're going very much front line with your workforce. So that workforce engagement in how they feel confident at telling their own story is critical. So get that right. So I'm going to stop there. I think we're going to questions. Thank you very much for listening.
Thank you very much, Karen and John. That was brilliant.